I'm Rebecca Stallions. I am here to talk about platelet-rich plasma therapy. So what is it? It's a non-operative, long-term procedure for overuse injuries. It actually accelerates the healing process in the body by injecting platelets from your own blood into the area site. So in my little diagram here, you can see how much plasma is coming out of the blood from the vial or the tube, whatever they use. And the only thing that is extracted out of the blood is the plasma. So the targeted conditions mainly is just stress and overload injuries, so mainly your tendinitises, your muscle tears, etc., all the stuff that we see daily. So tendinitis is what I see the most. I actually have never heard of the platelet-rich plasma therapy until about 3 months ago when we had an athlete that was considered to have the PRP therapy by Dr. Kendall. So I know there's 2 doctors from the Andrews Institute that likes to use this therapy, Dr. Kendall and somebody else. Rich, do you know the other doctor? There's who? Yeah, so I knew there was 2. Not many use it, but we'll get to that in just a few minutes. So who benefits from it? Technically everybody. I mean, whoever has an injury can benefit from it. But obviously if you are just, like a recreational athlete, if you don't do it often, then why would you pay for the procedure when, it will go away eventually? So usually professional athletes and geriatric patients with arthritis benefit from it. Utilizing in their practice, so like I said, Dr. Kendall and Dr. Hackle, is that who you said? So it is an outpatient procedure. Obviously you would not do this in the emergency room, even though there is so many people that come in for chronic pain. But it is usually used by orthopedic surgeons or physicians. So injection, step by step, this is what it is. There's so much that goes through, but I put it on a slide because it's pretty cool. So first, the blood is extracted from the patient by a nurse. It will then go into a centrifuge machine for about 5 to 10 minutes to pretty much decipher through all the components of the blood. It is then extracted from the tubing so that you get the plasma only, and then the patient is then prepared for the injection site, like cleaning the area, etc., etc. The physicians will usually use an anesthetic like lidocaine or something like that, just so it numbs the area, because it is kind of painful, because obviously a foreign body is going into your skin. But most doctors will use an ultrasound machine. Like Dr. Kendall, I know he really likes using ultrasound just because he's really good with it. But ultrasound helps for it to pinpoint exactly where the platelets need to go for the ultimate experience. Then the patient is then cleaned of the blood that comes out of the body and bandaged, and they are free to go. So this is a diagram or a microscopic picture of if you have PRP and without PRP. So obviously the platelets in the first picture, there's almost none, and then the second there's a lot more, so there's a better healing process with the platelets in the second picture. Recovery time is immediate. Obviously if you have an injury then you need to rest, but for the sake of the platelet-rich plasma therapy, it is immediate and you can go back to playing and so on and so on. So everything has a side effect, right? Usually you don't have these side effects if the physician knows what they're doing. But you still can get infection, nerve injuries, pain at injection site, and tissue damage. So indications is pretty much anything. So if rehab doesn't work, if they have a sensitivity to NSAIDs, if they don't want to use pain medication, which nobody should because everybody is getting addicted to it, surgical treatment is not desired or not optional, or it is affecting daily life and sport activity. So contraindications, there's also contraindications for everything, right? So you don't want to do it if you're pregnant, anemic, undergoing anticoagulation therapy, like if you have a deep vein thrombosis or a pulmonary embolism. Obviously you get put on blood thinners for about 6 months. So, so if the anticoagulation therapy cannot be suspended for amount of time to do the platelet therapy, then obviously it's a contraindication, bleeding disorders, and medical conditions that could worsen with the injection. Cost of therapy is very expensive. So actually there is a hair loss PRP, which I thought it was pretty cool, but it is so expensive. This is actually in California. So $900 to $2,500, whether you do one treatment or several. And then this varies from any city. Obviously, if it's a bigger city, the physicians get paid more, and so it will be more expensive to get the treatment. Knee injections cost about $500 to $1,200 per treatment, and none of this is covered by insurance because it's still under an experimental procedure code type thing. So it usually has to come out of pocket. And who wants to pay for that unless you got money, guys? So there is my references, and I am finished.